In HealthWorks, you know that diabetes is a widespread problem, millions of Americans, but in Michigan, our state ranks as the 15th highest in the nation for the disease. For diabetics, prevention and control is key, but sometimes that doesn't always happen. Dr. Jeffrey Frederick with the Michigan Podiatric Medical Association is here, and really we're talking about how this is a head-to-toe problem when it comes to diabetes, Doctor. Thanks for being here.
You're welcome, and you're absolutely right. Everybody's had a friend or a diabetic patient is well aware of losing a toe, losing a foot, losing a leg to diabetes.
Yeah, now why does it happen?
That's the biggest horror story. Well, there's a sequela of events that seem to go together. And the first thing that is, every diabetic patient, no matter how well they regulate their sugar, is going to have a decrease in circulation. Now, if you think about it, the lower extremities have the least amount of circulation to begin with because they're farthest from the heart. So you have a decrease of circulation. But the second factor on top of that is many diabetics develop what's called a neuropathy, a lack of feeling, and that comes about because the small nerve endings to the feet and legs die off because of the lack of circulation. So you have two things together that are very bad. So if a diabetic patient walks around barefoot, or let's say they're wearing a shoe that they can't feel because their feet aren't going to tell them the truth, the nerve endings aren't working well, they could develop an ulceration from a tight shoe. They may not be aware of that for days, and then an infection sets up. So if you have an infection, I can give you an antibiotic, and usually that works well. But remember, we said you had bad circulation or diminished circulation. So now we've got a problem. We can't get the antibiotics to the place it needs to go. So it's a huge problem for most diabetics.
What is the answer? Is it even, and as you say, even if you're managing your blood sugar levels as you should be, that's not really the solution. The solution is, do you have to constantly be looking, self-examining your feet?
Absolutely, absolutely. First, most of our diabetic patients that come in, the first step is education. You absolutely, as a diabetic, it's a must, should be on your agenda to look at your feet every day. If you can't, somebody else needs to look at the bottom of your feet. So understanding the process, looking at your feet. And what are you looking for, doctor? You're looking for any kind of small cut, insult, ulceration, anything that's abnormal for you as a diabetic would be a 5-alarm fire versus somebody that's not diabetic. So the first sign of the smallest thing should have professional help immediately. No two buts about it. The other thing that most diabetics are aware of, and if you just ask a diabetic patient, is their skin is so dry. And it's just part of the disease process. So we ask all of our diabetic patients to constantly use lotion on the lower extremities, because dry skin in the winter will become cracked skin, which becomes an avenue for bacteria to get in an infection to set up. So it's all about education, understanding it, and preventing infection.
Boy, and you know, something as simple as dry skin, it's hard to imagine that that can turn into something that really affects your quality of life. I mean, having an amputation, even if it's just a toe, or beyond, of course, that has a huge effect on quality of life.
Absolutely. They are life-changing events when you lose a toe or lose a leg or lose a foot. And not to mention, not that this is a selfish thought, but think about society in general, how diabetes is exponentially increasing in our society. The cost for that is huge.
Let me ask you real quick, Doctor, before we run out of time. We know that obesity is directly tied with diabetes, high blood pressure. What about kids? We know kids are more and more being diagnosed with these adult problems. Do you see these foot problems in kids?
Absolutely. We're seeing them earlier and earlier in children, and this is one of my biggest problems in society that I think we're facing. Is we're talking about kids exercising more and doing more in school, yet because of budgetary issues, we're taking away the physical education programs. So exercise is number one, and obesity in children is number two.
Yeah, it's such a huge problem. All right, Doctor, good information. We're going to put a link to your information on our website. Also, if you check out the checkup on the health page at myfoxdetroit.com, we put a link to some other resources. You can get a free copy of Dr. Frederick's book, Diabetes and Foot Care. So there's links to all of it at myfoxdetroit.com. Doctor, thank you.
You're welcome.
Good stuff.